All right, let's talk about something that's super important for any parent to know about: Staphylococcal Scalded Skin Syndrome. We're going to break down what it is, what to look for, and why getting help quickly is the name of the game, all based on some solid expert guidelines.
You know that feeling, right? Your kid has a rash and you're keeping an eye on it. But what happens when that rash starts to look different, when it turns into something that just feels more serious? That's what we're digging into today.
Okay, so let's start at the beginning. The story here usually kicks off with something every parent has seen a million times: a rash. But this one is a little different. So at first, you might just brush it off as a typical bug or a bit of irritation. But the key thing to know about this condition is that it evolves. It starts out looking innocent, but then it changes into something that definitely grabs your attention and tells you it's time to see a doctor. So what is really going on behind this dramatic change in the skin? Let's pull back the curtain and put a name to the culprit so we can really understand what we're up against. The official name is Staphylococcal Scalded Skin Syndrome, or SSS for short. Now, here is the absolute key. This isn't your average skin infection. The problem isn't bacteria on the rash. It's caused by toxins that are being released by bacteria somewhere else in the body. And this quote just nails it. It really helps you picture what's happening. The way the skin peels and looks raw is a lot like a burn you'd get from hot water. That's a pretty intense image, and it's exactly why it gets that scalded skin name. And who does this usually affect? Little ones. We're pretty much always talking about kids under 5 years old. And it's especially important to be aware of this in newborns because they're the most vulnerable and the illness can be really severe for them. So to really get what's happening, we've got to go a little deeper. Look at the science of it all. How in the world does this toxin manage to cause such a dramatic effect on the skin? Right, and this is so important to remember. The widespread rash you're seeing isn't actually where the main infection is. The staph bacteria have set up shop in one specific spot, and they're acting like a tiny little factory, just pumping these toxins out into the bloodstream. It's basically a three-step process. First, you get a small local staph infection somewhere. Second, that bacteria starts releasing these specific toxins. And third, those toxins hit the bloodstream, travel all over the body, and when they reach the skin, they act like a key that unlocks the glue holding the top layer of skin cells together. That's what causes all the blistering and peeling. So where is this toxin factory usually hiding? Well, in brand new babies, it's often an infection around the umbilical cord stump or maybe in their eyes, like pink eye. In slightly older infants, you might find it in a patch of infected eczema, a boil, or a case of impetigo. Okay, let's talk about the clues. Knowing the signs to look for is absolutely critical because catching this early makes all the difference. These are the things that both parents and doctors need to have on their radar. So, you're at home, your child isn't feeling well. What are the specific red flags that should make you think, maybe this is more than just a regular childhood rash? In the beginning, the signs can be kind of general. Your child might be super irritable, running a fever. Then you'll notice a widespread redness. And here's a key detail. When you press on it, it turns white for a second. That's called blanching. The skin might also feel rough, almost like sandpaper, and be really tender to the touch. From there, things tend to progress. You'll start to see these large, fragile blisters forming. They often show up in areas that get a lot of rubbing. Think the diaper area, or on their hands and feet. And then comes the most definitive sign of all. It's called the Nikolsky sign. For doctors, this is a major, flashing red light. It means the top layer of skin has become so loose that just a little bit of gentle pressure can make it wrinkle up and even slide off. It's a clear signal that something systemic is messing with the skin's structure. All right, so once the signs are there, the focus immediately shifts to getting a proper diagnosis and starting treatment. This is how the medical pros solve the puzzle and get your kid on the road to recovery. And this is so important. SSS can look a lot like other very serious skin conditions. This is absolutely not something to try and figure out at home. Getting a quick, accurate diagnosis from a doctor is everything, because the sooner the treatment starts, the faster everything gets better. Doctors will go through a list of other possibilities, kind of like ruling out the suspects in a mystery. They'll consider things like Stevens-Johnson syndrome or scarlet fever just to make sure they've pinpointed the right culprit because some of the symptoms can overlap. Once they're confident it's SSS, the treatment plan is clear, and it happens fast. The child is admitted to the hospital. They get antibiotics put directly into their bloodstream through an IV. This goes right after that toxin factory we talked about. And at the same time, they'll take swabs and cultures to confirm exactly what bacteria they're fighting. Now, in the more severe cases, where large areas of skin are affected, the care actually looks a lot like what you'd see in a burn unit. The main goals become managing fluids to prevent dehydration, keeping the child comfortable with pain control, and providing really gentle wound care to help the skin heal and prevent any other infections. And that brings us to the absolute best part of this whole story, the recovery. After an experience that is, let's be honest, terrifying for a parent, what does the outcome look like? Well, this is where the news gets really good. And that good news is based on solid medical expertise. The information we're sharing about recovery comes directly from the clinical guidelines put together by specialists at Perth Children's Hospital, so you can trust that this is reliable, reassuring stuff. And this right here, this is the message. Despite how scary this condition looks, if it's caught early and treated properly, the outcome is excellent. Kids are expected to make a complete recovery. And because the peeling happens on the very top layer of skin, permanent scarring is super unlikely. So, at the end of the day, learning about this isn't about causing fear. It's about being prepared. It's about empowering you to recognize those early signs, like that tender, sandpaper-like rash, so you can take action. So what's the one thing from all this that's really going to stick with you? Thanks for tuning in.